All right, so I'm going to start by washing my hands, and I'd be in professional attire if this was a real situation. My name is Lauren Reed. I'm a nurse practitioner student from WKU. I'm going to be doing a health history and a physical examination on you today. Is that okay?
Mm-hmm.
All right, and can you tell me your name and date of birth?
My name is Katie Henderson, 9/3/1992.
Okay. And do you prefer to go by Katie or Miss Henderson?
Katie's fine.
Okay. All right, Katie. So I'm going to start with your health history. Can you tell me about any medical diagnosis you might have had as an adult?
I have psoriasis. That's all as an adult.
Okay. Any as a child?
I have a lazy eye in my left eye.
Okay. And have you ever been hospitalized?
Mm-mm.
Okay. And have you ever had any major injuries?
No.
Okay. Any serious childhood illnesses?
Mm-mm.
Okay. Have you, do you take any daily medications?
I take spironolactone for acne.
Okay. Do you have any allergies?
Mm-mm.
Food, drug, or environmental?
Some seasonal allergies.
Okay. Are your immunizations up to date?
Yes.
Okay. Do you have any mental health illnesses?
No.
Okay. When was your last menstrual period?
A week ago.
Okay. And when was your last health screening?
I had a pap smear in August.
Okay, great. Okay. Can you tell me a little bit about your family history, starting with your grandparents?
My mom's adopted, so I don't have family history on her side.
Okay.
My dad's dad had lung cancer, passed from that, and then my dad's mom had a CVA that eventually led to her passing, and yeah, that's really
Okay. And what about your parents?
My dad has some anxiety. My mom had had gestational diabetes and has pre-diabetes now.
Okay. And siblings?
My brother has ADHD.
Okay, awesome. Now just for some social history.
Mm-hmm.
Do you have any spiritual or cultural considerations that might affect your care?
No.
Okay. And what about environmental factors?
I'm a nurse, so I would get exposed to things at work sometimes with the medications.
Okay, and
themselves.
so that's your occupation as well as being a nurse?
Mhm.
Okay, and your highest level of education?
I'm working on my doctorate.
Oh, congratulations.
Thanks.
What about marital status? Are you married or?
I'm engaged.
Oh, congratulations.
Thanks.
And your sexual activity?
I'm in a monogamous relationship with my fiance.
All right. And what about tobacco products? Do you smoke, vape?
Mm-mm.
Okay. What about alcohol? Do you drink?
Socially, maybe 1 or 2 drinks a week.
Okay. And what about recreational drugs?
No.
Okay. All right. What about your diet? Do you have a good balanced diet?
Yeah, I eat fairly healthy.
Okay. And what about exercise?
I try to get to the gym a couple times a week.
Okay, great. And what about sleep? Do you sleep okay?
Yeah, I sleep pretty well.
Okay. Yeah. And do you have any concerns about cost of care?
Mm-mm. No, I have health insurance.
Okay, awesome. And have you had any recent travel exposure?
Mm-mm.
Okay, perfect. Now I'm gonna start with the physical exam.
Okay.
Okay. I'm going to start with taking your blood pressure. So I'm going to feel for your pulse in line of the blood pressure cuff with the artery.
Slippery little guy.
There we go. Okay. Your blood pressure is 114/78. Is that about what you normally run?
Mm-hmm. Yeah, usually 110 hours.
And now I'm going to feel for your pulse. And I'm watching your respiration. Your pulse was 64 and your respirations were 16. I only counted for 30 seconds for time's sake, but I would count for a full minute. Okay. And now I'm going to take a temperature. The battery's dead, but it was 97.8. All right. Okay, so that was your vital signs. So now I'm going to start with inspecting your face, scalp, and skull.
Okay.
Your face is symmetrical. Your skull is
Round.
yeah, it's round. I'm going to look at your scalp, and okay, I do notice some psoriasis. And do you see a dermatologist for that?
Mhm.
Okay. Alright. And now I'm going to start with the ear exam. So I'm going to inspect your ear and the pinna. I'm going to palpate for tenderness on your tragus. Okay, move back on this side. Okay. Alright. Now I'm going to look in your ear. I'm going to pull your pinna up and back. Insert the otoscope, and I'm looking for the cone of light, the eardrum, and the malice. Okay, do that. And now the other side. Sorry about the cord. Okay, going up and back. Alright, and I see the eardrum, the cone of light, and the malice. Alright, okay. Now I'm going to assess for hearing. I'm going to have you cover one ear, and I'm going to whisper into the other and have you repeat after me.
Okay.
So just cover one of the two.
Good morning.
Okay, and the other.
How are you today?
Perfect. Okay. Now I'm going to assess your nose.
Okay.
I'm going to look at the anterior and inferior surface, and I'm going to grab my pen light, and I'm going to just push up and back and look at the nasal vestibules. Okay, they look great. And do you smell okay?
Yeah.
Okay, no problem with your sense of smell.
All right.
And I'm just going to now insert the otoscope and look at your middle and inferior turbinate.
Okay.
Okay. And at your nasal septum as well. Hold in there. This thing doesn't want to latch on. Okay. Now I'm going to start with the eye exam. Okay, so this is a visual acuity eye card. I know you told me before the exam that you are visually impaired in your left eye.
Yeah.
So with your right eye, I would like you to close your left and read the lowest level that you can read.
4, 2, 6, 7, 3, 9.
Okay, and then
Let me do it with my left.
yeah, just to see where we are.
2, 8, 4, 5. 2, 8, 4, 5.
Close. That's pretty good. Okay, and do you see an eye doctor for yours?
Yes.
Okay. All right. Now I'm going to just inspect your eyebrows for distribution, your position of your eyes, maybe the top of your ears. Can you close your eyes? I'm inspecting your lens and your eyelashes and your irises and your pupils are equal and even. I'm going to inspect your conjunctiva and your sclera. Just going to pull down. Okay. And your lacrimal gland is not clogged. I'm going to look at the side of your eyes and examine the lens. Look straight ahead. Okay. And now I'm going to test for your pupillary reflexes. So just look straight at me and I'm going to shine a bright light. Okay. And they constrict and are brisk and consensual.
Okay.
Now I'm going to test for accommodation.
Mhm.
So can you see the top of the door corner right there?
Mhm.
All right, I'm going to look there and then look at my pen light. Okay, and back at the door and back at the pen light. Okay, and they constrict when near. Now I'm going to assess your ocular movement. So I'm going to just shine a light and look for the reflection in your cornea. Okay. And now I'm going to test your 6 cardinal gazes. So just follow my finger in a fluid motion. All right, and I'm going to test for your visual fields as well. So I'm going to just pull my fingers wiggling around your head. Can you just tell me when you see them?
Yep.
Get nice and close.
Yeah. Yeah. Yeah.
Perfect. All right, and now I'm going to use my ophthalmoscope to look inside your eye for optic vasculature. I'm going to use my hand to stabilize myself. Okay. Okay, and I see the optic vein. Drink of water real fast. Okay, let me grab a popsicle stick. I'm going to now assess your mouth.
Okay.
So I'm looking at your lips and
I'm gonna try right now.
you're licking your lips like that. And your teeth and your gums. Okay. And I'm gonna use this popsicle stick to look at your teeth and your gums and the sides of your cheeks. Okay. And can you stick your tongue out? Looking at the side of your tongue and up to the roof of your mouth. Looking under the tongue. Okay. And now can you say ah? Okay, look at the hard palate and the soft palate. Say ah again. Look at the larynx and tonsils. All right. And I would assess for your gag reflex during that examination, but I'm going to save you from that. Okay, now I'm going to inspect your neck, and I'm going to look for tracheal deviation. Okay, there's no deviation. I'm going to assess for range of motion in your neck. Can you flex your neck and extend your neck and rotate from side to side and laterally bend by putting your ear to your shoulder? Okay, any pain with that? Okay. All right, now I'm going to palpate your lymph nodes. So your submental, submandibular, tonsillar, parotid, your cervical chain, and your supraclavicle. Don't feel any lymph nodes. All right, now I'm going to inspect your your thyroid gland. Can you just look up a little bit for me? Okay. Looking for the chichorine process. Cartilage. Cartilage. There we are. Okay. And I'm feeling your thyroid and the thyroid isthmus. And then I'm going to have you bend down. And I'm going to push it to the side to feel the left lobe, and then push it to the other side to feel the right lobe. Okay. Any tenderness with that? Okay. All now we are going to do our posterior thorax exam. So I would have the patient in a gown and be able to examine the back without having any clothing on. So first I am going to examine the back, and then I'm going to palpate the vertebrae for tenderness. You tell me if you have any tenderness. Okay, and I'm going to assess for costovertebral tenderness. I'm just going to hit my hand, just let me know if it hurts.
Nope.
Okay, I'm going to palpate in 4 areas. All right, and I'm going to place my hands on the 10th rib and have you take a deep breath. Okay, assessing for symmetry with inhalation and exhalation. Okay, and now I'm going to palpate for tactile firmitis. Can you just repeat 99 every time I move my hands?
99, 99, 99, 99.
Okay, all right, and now I'm going to percuss in 7 areas of each lung. Now I'm going to listen. I'm just going to have you breathe through your mouth during this, okay?
Okay.
All right, now for your anterior thorax exam, I'm going to have you go ahead and lay back for me. Okay. I'm just going to palpate. Tell me if you have any tenderness. Okay. And I'm going to assess and inspect for symmetrical movement. Beautiful. Now I'd have her bare skin exposed. Now I'm going to palpate for tactile firmitis. That's stunning. Okay, just say 99 for me.
99, 99, 99, 99.
Okay, and now I'm going to percuss in 6 areas on each line. Listen in those same 6 areas. I did on the back. Can you breathe through your mouth? All
That's a
right.
lot of breathing.
Yep. Do you need a drink of water?
No, I'm okay.
Okay. Now I'm going to do the cardiac exam. So I'm going to inspect for any impulses, looking to see if I can see the apical impulse or any other movement. I don't see any. Now I'm going to palpate the apical impulse. Okay, if I feel it. And I'm going to palpate for the right ventricle pulsation. pulsations. I'm going to start in the right second inner space and the left second intercostal space. And the third and the sternal border and at the apex. And again with my bell. Okay, and I heard the S1, S2, no murmur. Now I'm going to assess for jugular pulsations, jugular pulsations. Can you just look towards the wall for me? Okay, and can you look towards the cabinet? Okay, I didn't see any. Now I'm going to inspect for carotid pulsations. I don't see any. Now I'm going to palpate the carotid pulse. Okay. Okay. Amplitude and contour are even. Now I'm going to auscultate for bruit. Can you hold your breath during this? Okay. Didn't hear any bruit. Okay. And that is the end of our cardiac exam. Now I'm going to move on to the abdominal exam. So again, I would have the patient exposed to be able to inspect the bare skin. I'm going to start by auscultating in all 4 quadrants. And the epigastric and suprapubic arranging. So, okay. I'm going to go ahead and palpate the aorta. Okay. All right, now I'm going to percuss in all 4 locations. Now I'm going to percuss the liver for dullness, starting in the right midclavicular line, going upwards. Okay, and then can you hold your breath back for a little bit, and I'm going to go down. Okay, all right, let me grab my real fast. And I'm going to measure that area in centimeters and about 7 centimeters. Now I'm going to percuss the spleen for dullness. It's better to do it from this side. Okay, and can you take a deep breath and hold it? Okay, all right. And now I'm going to palpate your abdomen lightly in all 4 quadrants. I'm going to deeply palpate all four quadrants using a rocking motion. Okay, and now I'm going to palpate the liver. And take a deep breath. And let it out. Alright, okay. And now I'm going to palpate the spleen and the fold. On the other side of the rib cage. Okay, you can take a deep breath. Okay, and exhale. Okay. Alright, now I'm going to palpate your femoral arteries. And your inguinal lymph nodes. Okay. And now I'm going to palpate your kidney. So I'm going to push up under your rib cage on your back, and it's not very comfortable. I'm going to push down on your stomach. And can you take a deep breath? Okay, and let it out slowly. Okay, let it slide back into place. And again on this side. Okay, take a deep breath. And let it out slowly. Okay, slide back in. Alright, now I'm going to go ahead and have you sit up. Okay, and I don't know if this really part. I forgot earlier to do your cranial nerves. I'm going to do that real fast.
Okay.
So the first is olfactory. I assess that by asking if you have any issues with smell. The second is optic. The third is ocular motor. We already assessed both those. The fourth is trigeminal. We already trochlear. We already assessed for that. The fifth is trigeminal. That I'm going to have you clench your teeth for me. Okay, and then clench again. Okay, perfect. And then the sixth is abducens. We already assessed for that. The seventh is facial. Can you smile for me and frown for me and raise your eyebrows and puff out your cheeks? Perfect, thank you. The eighth is acoustic. We already assessed for that. Ninth is hypoglossal, and the 10th is vagus. We already assessed for that with your gag reflex. 11 is spinal accessory, and I'm going to have you shrug your shoulders, okay, and push your hand against my face, and again, okay. And then for the 12th, can you stick out your tongue, and can you push it against your cheeks on each side? Perfect. All right, thank you. Okay, so now I'm going to start your extremities, and I'm going to do your upper extremities first. So I'm going to start by inspecting your hands, your joints, your nails, your wrists. I'm going to palpate your joints for any tenderness. Okay, I'm going to compare your radial pulses. Okay, I'm going to palpate your distal radius and your distal ulna and your snuff box. Okay, I'm going to do some range of motion with your fingers. Can you make a fist? Can you spread them out? Can you put your fingers together like this? Can you take your fingers and slide your thumb to your pinky? And then can you do thumb to each finger? Perfect. And can you take your wrist and flex and extend and deviate to each side? Perfect. Okay. And now I'm going to assess your elbow. I'm going to assess for your epitracheal lymph nodes. Okay. And for range of motion, can you flex and extend? Perfect. Okay. And now I'm going to assess your shoulder. So I'm going to palpate for the greater trochanter of the humerus the column process, the clavicular column joint, and the coracoid process of the scapula. And again on this shoulder. Okay, and while I'm here, I'm going to assess your axilla. Can you raise your arm and let me assess the skin? Okay, and again on this side. Okay, perfect. Now I'm going to assess for lymph nodes in the axilla. I'm just going to push up in here.
Sorry, deodorant.
That's okay. To feel for them, and then down the side of your arm. Okay, and again on this arm. All right, I know we're good on time. Oh, okay. And now I'm going to do range of motion of the shoulder. So can you flex your arms straight out, hands down, and then straight up, hands together, and then can you internally rotate your hands and abduct them, and then can you adduct and externally rotate, put your hands back. Perfect. All right, and that completes our upper extremities. Now for our lower extremities, I'm going to have you go ahead and lie back again. I'll pull off this little table. All right. So I'm going to assess the feet and the ankle and the heels. I'm going to palpate for pedal edema, the tops of the feet, the backs of the ankles, and then you are wearing pants on your shins. I'm going to palpate the metatarsal phalangeal joints of your toes. Okay, and the heads of your metatarsals. Okay, and your dorsal pedis pulses. And your posterior tibial pulses. Okay, and now can you flex your feet, dorsiflex and plantar flex, and can you spread your toes? Perfect. All right. And make sure I pop it underneath the feet as well. Okay. And now I'm going to inspect and palpate the knees. I'm going to palpate the medial femoral condyle and the lateral femoral condyle, the medial tibial plateau and the lateral tibial plateau, the tibial turbosity, and again on this knee. Okay, I'm going to palpate the patellar tendon. I'm just going to have you bend your knee. And I'm going to palpate the medial and lateral condyle ligament and the meniscus as well. And I'm going to assess the patellar for swelling. Okay, no swelling. All right, and then I already assessed range of motion of being able to flex and extend by feeling your tendon. I'm just going to put this down for just a second and have you bend your knees and just swing them side to side. Okay, perfect. All right, lay back down for a minute. Okay, now for the hip, I'm going to inspect the hip and then I would have her undressed, and then I'm going to palpate for the iliac crest, the anterior superior iliac spine, the iliac terpical, the posterior iliac spine, the greater trochanter of the hip, and the ischial turbosity. And again, on this side, and now I'm going to do some range of motion of the hip. So I'm just going to have you bring your knee to your chest, and I'm going to feel your hip while I do that. And then I'm going to have you take one leg and bring it out towards me. Okay. And then again over your leg there, okay? And then on this side, we'll bring it out, add an adduct, okay? And now I'm gonna test for a rotation, so I'm just gonna hold the bottom of your ankle. Can you bend your knee? Okay, and then we're gonna rotate in and out. Perfect. All right. And again on this side, rotate in and out. Okay. That completes the lower extremity exam. Go ahead and sit up for me again. Thank you very much. Okay. Now for the neuro exam, I am going to assess our level of consciousness. So we were alert and oriented during the examination. We used appropriate language. We had appropriate short-term and long-term memory loss, or memory. We had abstract reasoning, overall appropriate level of consciousness. Okay, and now for our coordination, I'm going to assess fine and fine motor here in just a little bit, but I'm going to go ahead and can you put your arms out for me like this? Okay, I don't see any pronator drift. You can put them down for me. I have not seen any involuntary movement. I have noticed appropriate tone, bulk, and muscle strength throughout the exam. Oh, I didn't do your upper extremity. So I'm gonna test for muscle strength in your upper extremity. Can you spread out your fingers and then don't let me push them together? Okay. Okay. And flip them over for me. And then I'm gonna hold your thumb and your pinky. Can you try to make them touch still? Okay. Okay. And can you make a fist? And I'm gonna try to push down, don't let me. And try to push up, don't let me. Okay. And like this. And I'm gonna try to pull. And then I'm gonna push. Perfect. Okay. And I'm gonna do that in your lower extremities as well. So I'm gonna have you try to push your thighs up against me, okay? And then try to pull them down, okay? And try to push your thighs together and push them apart, okay? And your leg, can you kick your leg out and kick your leg out and pull it back in and pull it back in and push up against my hands and push down against my hands. Perfect. All right, so appropriate muscle strength throughout the examination. Now I'm going to assess for fine motor movement. Can we do a rapid movement? I'm going to have you take your hands and flip them upside down as fast as you can. Perfect. Okay. And then I'm going to have you tap your foot to my hand as fast as you can on your heels. Perfect. Okay. And then can you take your heel and put it to your knee and slide down, your point to point. Perfect. And the other leg. Perfect. And then point to point with your upper extremities. Can you touch your nose and my finger, and nose, finger, nose, finger. Perfect. Now I'm going to assess for proprioception by doing an examination of your feet and fingers. So I'm going to have you close your eyes, and then I'm going to move your toe up and down, and just tell me which direction you think it is. I'm going to tell you first. So this is up, and this is down. Okay?
Up, down, up, down, up, up, down, down.
Okay, and your fingers. This is up, and this is down.
Okay. Up, down, up, 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 down, down, up.
Okay. And now I'm going to assess your reflexes. You're so thirsty. Okay. So first I'm going to assess your brachial reflex. I'm going to put my hand here. Hit. Okay. And the other side. My shoe keeps squeaking. Okay. And now I'm going to assess your tricep. And now your brachial radialis. So I'm gonna have I want to keep your arm nice and relaxed. Okay. And now your patellar reflex. Okay. And now your Achilles. Okay. And I'm just gonna have you lay back and I'm gonna assess your plantar reflex.
Tickles.
Okay. No Babinski's gonna sign. Alright. Now I'm going to assess our gait and back range of motion. So can you stand up for me, please? And I'm just gonna have you walk to the door like normal. And back. Foot to heel to toe. Okay. And can we walk on our tiptoes to the door? And can we walk back on our heels? Okay. And then can you stand with your feet together? I'm going to do the Romberg test. And close your eyes for 20 seconds. Okay. And then open. And then I'm going to do your back range of motion. Can you bend over and touch your toes? Okay. Can you bend backwards? Okay. And then can you laterally bend as far as you can to each side? Okay. All right. And that concludes my examination.